And moving on now to vaccination, something that a lot of people still following up on whether or not this will be in practice and when. The mix and match vaccination practice, in which a shot of a whole virus vaccine is followed by a shot of a vector vaccine, can boost immunity, according to the prominent Thai virologist, Professor Dr. Yong Poovorawan, head of Chulalongkorn University's Center of Excellence in Clinical Virology, adding that over 30 scientists and medical experts at the center are working on 5 COVID-19 vaccine projects. It has been found that a shot of Sinovac, which is a whole virus vaccine, followed by a shot of AstraZeneca, which is a vector virus vaccine, works well in boosting immunity. The whole virus version works in a way similar to getting us infected, and it helps our bodies become familiar with the virus, he said. When injected with different kinds, such as the vector virus type, it has what is called a booster effect. And it's like when someone has recovered from a COVID-19 infection and then receives another shot, and their immunity would be boosted again. This is what the Dr. Yong said. The center has also conducted a study using the mix and match approach on the inhibition test, which can fend off the virus by an average of 95%, with some reporting 99%. He said the center is also conducting a study on the Delta variant, which is becoming more dominant in many countries, including Thailand here, and on the T-cell immunity. Dr. Yong said that the mix and match approach of Sinovac and AstraZeneca can boost immunity within 6 weeks, as opposed to 12 weeks needed for vector vaccines, and that using AstraZeneca as a third shot after 2 Sinovac shots will help achieve very high level of antibodies. And this remark of his followed Thailand's National Communicable Disease Committee's, or NCDC, decision yesterday to use the Oxford AstraZeneca vaccine as a second dose for people who have only received the first dose of China's Sinovac vaccine, and as a third booster shot for medical personnel, most of whom have been fully vaccinated with Sinovac's CoronaVac, with many still getting infected by the virus. Dr. Yong also said that this approach is to help maximize the resources Thailand currently has, as now the country has only received these 2 types, which is the whole virus type, which is Sinovac and Sinopharm, both from China, and the vector vaccine, which is AstraZeneca, which is being locally produced here in Thailand. And Thailand has received about 14.5 million doses of Sinovac, 2 million doses of Sinopharm, and more than 7 million doses of AstraZeneca. The virologist has been under fire recently for expressing medical opinions deemed in favor of the government's vaccination campaign amid calls for the use of mRNA vaccines instead. And yesterday, the World Health Organization, or WHO's chief scientist, Somya Swaminathan, told an online meeting the mix and match practice is a bit dangerous. We are in a data-free, evidence-free zone, it will be a chaotic situation in countries if citizens start deciding when and who will be taking a second, third, or even a fourth dose, she said. But she clarified later in a tweet last night that her comment was only meant for individuals who should not decide for themselves, while public health agencies can based on available data.